About 7.5 million people in the U.S. suffer from psoriasis. It has no known cure, but the symptoms can be treated. Dr. Robert Clemons with Tri-Cities Skin and Cancer is an expert that knows all about this chronic condition, and he joins us this morning to discuss the treatment options that are available. Dr. Clemons, appreciate you being here today. Thank you so much.
Thank you for having me.
First of all, we all have heard the term psoriasis. Exactly what is it?
You know, psoriasis is an inflammatory condition, and it's involving your own immune system that comes and attacks your body. We see it on the skin, but it actually involves a lot of other areas. It can involve the joints. It can involve the heart. We know that patients with psoriasis have a higher incidence of heart disease. It can involve the nails. It can involve the hair. Psoriasis involves 2% of the American population, and worldwide 125 million people have this disease. And treatments are available, and depending on how bad your psoriasis is, there are lots of different options. The problem is some of those options can be expensive, some of them can be burdensome, but there are options that are available.
Now, we have some photos of actual examples of psoriasis if we want to run through. There's one on the neck, and talk to us about how psoriasis presents itself.
You know, psoriasis comes up as a very red, very itchy, sometimes very cosmetically disappointing condition. So you can see here, you know, someone with this kind of condition would have a difficult time going to the swimming pool.
Right.
Somebody with the condition like in their scalp would have a hard time at a job interview. People that have significant psoriasis of the nails feel embarrassed about handshaking and otherwise. And so it impacts people in so many different ways. With the joints, it can be extremely difficult to exercise. And then we talk about the heart problems with psoriasis. If you can't exercise, how can you lose weight? And so this condition can be so impactful to lives.
And I understand the treatment options that are available are everything from like topical creams all the way to oral medications.
Correct. You know, for simple small areas of body involvement, you know, simple topical steroids and topical vitamin D products are great and can work quite well. But when you have 80% of your body surface area covered with psoriasis, you can't cover that much of your body with topicals. And that's where we have systemic medicines. The problem with those systemic medicines is that they can be expensive. Either expensive to get them or expensive in monitoring for them. And that's where we have a lot of options that we've come available. Our goal in our office is to find treatment options that there are generic availabilities to. And so far right now, there aren't very many generic medicines. And so our hope is to start doing some research and some clinical trials that can look at some of these newer drugs, these systemic drugs that work not only on the skin, but also on the joints, the nails, the heart as well, and find generic drugs that are available that work just the same, but may put competition in the market.
And you're looking for specific people to be involved in these clinical trials. You're
Correct.
Encouraging people to come to your office and get involved.
Absolutely. We have a lot of different clinical trials that are going on. One very exciting one is a study that we have with what's called a bioequivalent. And it's an equivalent version of a systemic drug that's already available. And we're looking for patients that have severe psoriasis, involving more than about 10% of their body surface area. This study is looking at patients who are over the age of 18 and are willing to come in for, it's about a year, and it's nice because it's a year where the drug is free. All the clinical laboratory procedures, all the x-rays and EKGs and all of that is actually provided to the patient. And it's just looking to see if this new generic is as effective as the trade version. And it's a wonderful opportunity for people who have significant psoriasis and just don't have access to these more expensive drugs. We're going to be looking for about 5 to 10 patients that are available, and so we're hoping if anybody's interested that they'd let our office know.
This is a wonderful opportunity for folks that may be a little short on their insurance or something along those lines.
Absolutely, or just have really bad psoriasis and just haven't been able to take that next step. There are some really good options. We're really excited about psoriasis in the fact that there are so many drugs that are now available. 10 years ago, a person like that couldn't get employment. They couldn't go out to the pool. And there's so many great things that are coming available, and we're just getting really excited about some of these new options. And certainly if that patient's there and just feels like they don't have the ability, we may have an option for them, and we want everybody to be aware of that.
All right. Dr. Clemons, thank you so much for being here today. Great information. If you have psoriasis, head over to Tri-Cities Skin and Cancer. Get involved in these clinical studies. They're at 1009 North State of Franklin Access Road in Johnson City. There's a number, there's a website. They would love for you to get involved with those clinical trials today.
The preceding portion of Daytime was sponsored by